Well, there's a chance, or a change rather, in your child's education coming beginning next year. Elementary, middle, and high schools in the state will be required to include mental health education in the health curriculum. Channel 2's Dave McKinley joins us from inside the Information Center with more. Dave?
Mary Alice, the details on how they're going to teach this is still being worked out, but we were able to speak with an expert today about why teaching it is so important.
You know, New York State is the first in the country to be doing this, and I think that's phenomenal that we are taking the lead and setting an example for the rest of the country on what to do and how to help these young people.
Carl Shallowhorn is Director of Community Advocacy for the Mental Health Association of Erie County and Compeer Buffalo. He's also on the board of the Mental Health Association of New York State, which pushed for the legislation behind this and is now working with the state education department to develop the curriculum.
Frankly, we need this, and we need it more than ever, I believe.
It is estimated that 1 in 5 people live with some sort of mental disorder or disease.
And a lot of these symptoms and signs and diagnoses have their age of onset during these early years.
Indeed, according to the Mental Health Association, the average age of early signs of mental illness is 14. But sadly, the average age that individuals seek help is 24. That's 10 years, which elapse perhaps the most formative years in any person's life. And 60% of high school students who have a mental illness do not graduate.
And that's the whole point, Dave. We want to get help to people early. So the earlier intervention, the better chance of a positive outcome. We know that.
So why teach about it?
Students will be more knowledgeable. Actually, also teachers will be more knowledgeable of what to look for if a person's in need of help. They'll be able to know what the resources are. And by having it in the curriculum, it'll normalize it. And that's a lot of what we're talking about here, is normalizing the topic of mental health.
Translation: if you're teaching them about leading a healthy lifestyle and avoiding risky behavior or the illnesses that can impact same, then why not teach them about this?
Understanding that it's something that we can discuss just like we discuss any other type of health issue, whether it be diabetes or cancer or whatever.
According to Shallowhorn, the goal, like in many other curricula, is for the state to issue guidelines and then leave it up to schools on how to meet them. Although, like a lot of other things taught in health class in particular, the aim is to at all times keep that information shared age appropriate. In the Information Center, Dave McKinley, Channel 2 News.